You will never forget the treatment.
33-year-old single bread woman person in the family and developed cancer. Okay, stage 4. After so many chemotherapies, the first time the scan came clear. Important one is the daily pollution. We are living in polluted water, polluted air, polluted food, polluted mind.
Okay.
Second is the genetic. Sometimes around 15 to 20% of cancer happens in the family.
What is the difference? Tumor and cancer.
Tumor is a combination of any type of overgrowth happening in the body. Cancer is something 15 to 20% of cancer will run in family. So many times patients say, sir, in my family there was nobody. I developed cancer. Why?
Sir, what kind of cancer Steve Jobs have? And also, what methods can be done?
Wonderful question. You will be surprised to know Steve Jobs, who has access to everything. Everything. You know what to be avoided. Everything which harms your body.
Okay.
You should avoid. For example, tobacco. You know.
Yeah, I know.
To be avoided. Alcohol to be avoided. Smoking to be avoided. And smoking in any form to be avoided. In last 15 years of my experience, one or two cases we actually got benefited with some form of alternative therapy.
Hi guys, today మన పాడ్కాస్ట్ లో మనము క్యాన్సర్ టాపిక్ గురించి తెలుసుకుందాం. మన స్టూడియోకి డాక్టర్ భరత్ బరోడియా ఈజ్ ఏ ఫేమస్ ఆంకాలజిస్ట్. సో మన స్టూడియోకి వచ్చారు. నమస్తే సార్.
Namaskar.
So first of all, what is oncology and why you choose this field?
Oncology is science of treating cancers.
Okay.
By whatever method.
Okay.
Medicine, surgery, radiation, or now there is something new known as cell therapy.
Okay.
So whichever methodology we are treating cancer, it is oncology. How I chose, I think it was God's plan.
Okay.
I never thought that I will become cancer specialist, but it just happened that I went to the counseling, and at that moment I felt okay, I will take oncology as my specialty, and then I jumped into oncology. I really liked because I'm making difference in the life of patients. So much of difference that additional 6 months, 1 year extra which I am giving, and patient is able to fulfill their life, their dreams. So I felt happy about it, and I continue to stay in oncology.
Sir, what is one patient you will never forget the treatment? Like,
There are many incidences, many patients. Every patient I remember completely. But if you say pick one, I will pick one recent case. Young male, 33-year-old, single bread willing person in the family and developed cancer.
okay.
Stage 4. Operation done, chemotherapy done, immunotherapy done, 1.5 year treatment was going on, and we could not cure him. The cancer was still there, and we tried a novel treatment known as CAR T cell therapy, and the patient underwent that treatment, and after so many chemotherapies, the first time the scan came clear. So I distinctly remember this case. But yes, there are cases like pancreatic cancer cases. Usually pancreatic cancer stage 4 lives around 9 months, 1 year, like that. But this patient lived for 5.5 years. When there was the story of a young 10-year boy in 2019, and everybody said he's going to live for 6 months, but he is getting married just recently.
Okay.
So there are many stories, but these are the stories which come up. And for that reason, I put the paintings made by children or daughter, son of the patients in my chamber for memory.
Okay.
Yes.
Sir, how does cancer start in the body?
Okay. Very simple. If anything is damaging your body,
Okay.
for example, chemical exposure, let us say some very spicy food, alcohol or smoking, tobacco, anything which is hurting your cancer, your body cells divide
Okay.
to repair.
Okay.
Whenever a repair is happening, let us just say, don't quote my number, but let us say out of 10,000 multiplication is happening, one abnormal multiplication happens.
Okay.
Out of such 10,000 abnormal multiplication, body rectify almost all.
Okay.
But because there is a pressure on the system of dividing fast because of tobacco, alcohol, or whatever reason, that one particular division, that cell learns how to grow too much.
Okay.
That intention of growing too much ultimately becomes cancer.
Okay.
That is how all cancers start. For some cancers, we know risk factors like tobacco, alcohol. For some cancers, we don't know why it happens. Like brain cancer, why it happened. So like that.
What factors or causes lead to cancer?
An important one is the daily pollution. We are living in polluted water, polluted air, polluted food, polluted mind.
Okay.
Second is the genetics. Sometimes around 15 to 20% of cancer runs in the family. So mother had cancer, then daughter developed cancer, or father had a cancer, then son developed cancer.
Okay.
These kind of situation. And sometimes there is something known as radiation, background radiation, that also can cause cancer. For example, in Kerala, there are a lot of radiation in the soil. So that can cause certain cancer. Polluted food can cause cancer. And then the gene.
Okay. What is the difference between tumor and cancer?
Okay. Tumor is a broad word. Like if I say, I want food.
Okay.
So food can be paratha, can be dosa, can be rice, can be noodles. So food, so tumor is a combination of any type of overgrowth happening in the body.
Okay.
Cancer is something when a tumor learns how to start from one place, jumps to other body part, and can grow to the rate at which it can actually cause death. Life threatening it can become. So the tumor is general word, and a part of tumors are cancers. So there are benign tumor, malignant tumor. So malignant tumors are known as cancer in general language.
Okay.
Right?
Okay, sir. Is cancer more dangerous than other diseases, right?
So there was a time when people used to die because of malaria,
Okay.
because of TB,
Okay.
simply because we did not have a good quality medicines. Why? What I mean by quality is a medicine which can cure it completely.
Okay.
But then there new medicines came, and now hardly very minority of patients actually die because of malaria or TB or something.
Okay.
Compared to let's say 1960. Now in field of cancer, unfortunately, still today we don't have a very highly effective type of treatment, and that is why I will say it is dangerous. But I can see then in future, in my lifetime, it will happen that there will be beautiful medicines for cancer, that cancer patients can live for years together. So then cancer will become another blood pressure medicine. It just continues lifelong, cancer remains controlled, patient lives normal life. This is going to come in my lifetime only.
Okay, sir. Does plastic cause cancer?
Plastic does damages your body.
Okay.
And plastic is there with us for last 20, 30 years, 40 years like that.
Okay.
And it's a new particle in the nature. So it does damage our body. And as I said, any constant damage which is happening can ultimately result in cancer, whether chemical exposure. So plastic, you can consider that yes, it can cause cancer. Personally speaking, I don't consume my food in plastic. I use glass or metal. So I suggest you don't use plastic.
Okay. Cancer can run in families.
So 15 to 20% of cancer can run in family. So many patients says, sir, in my family there was nobody.
Okay.
I developed cancer. Why? So one reason could be that there was no gene carrying the disease in the body, and this time this patient became the first patient to develop cancer, and the next generation is at risk.
Okay.
So especially the cancer which is known to be familial, like they run in family,
Okay.
whenever cancer patient comes, we always check the genes responsible for that. For example, most common is breast cancer.
Yeah.
Breast cancer, ovarian cancer, prostate cancer, pancreatic cancer, they can run in the family. So every patient who develop these cancers, young age, we find out, we do the full testing of the patient. If it is positive, then of the children to say whether it is familial or not. You never had cancer in the past does not mean that you cannot have familial. Because in the past, death could happen because of infection, because of age, because of now people don't die because of heart, but earlier heart problem. So before cancer comes, somebody might have died because of some other reason.
Okay.
In the past, we don't have a health record.
Yeah.
But now, every young patient, we have to find whether it is genetic or not, familial or not.
Sir, what kind of cancer Steve Jobs have, and also what lessons can we learn from it?
Wonderful question. You will be surprised to know Steve Jobs, who has access to everything, had a cancer known as neuroendocrine.
Okay.
But the learning point from his case is, if he would have gone to Europe,
Okay.
there were some experimental therapies at his time. Now, though, it is proven that those experimental therapy help neuroendocrine type of tumors. But at that time, when he was getting ill, it was not available or it was not approved in US.
Okay.
So, for some reason, he chose not to go to European centers and get this therapy done. Otherwise, we could have seen Steve Jobs for a couple of years more. So, the learning point is, whatever type of cancer, take second opinions. Take second opinions from research institute where the drugs are designed. So, as I was saying, a patient thinking of a second opinion
Okay.
should take a second opinion from research university where the medicines are designed or discovered, experimented. If you take a second opinion from another doctor in your city, no additional information is gonna get, because the knowledge of one doctor who is seeing patient is same like the other doctor who is seeing patient.
Yeah.
You have to take second opinion to these type of universities like in Germany, Switzerland, China, Russia. So now your question will be, from where to find these centers? So now there are already well established centers where you can take online opinion with such universities. Like our center we are tied up with Chinese Academy of Medical Science and Russian universities. So there are centers in Chennai which are tied up with USA based universities like MD Anderson. So choose second opinion these centers. No point of taking second opinion with another doctor in your city.
Yeah.
So Steve Jobs missed this part. Keep your mind open. Time is changing. Every day there is something new coming up. Use it. You will live longer.
Sir, how to treat cancer?
Very simple. Cancer treatment in 1940s something was very, very, very simple. There was nothing to treat with. Do only surgery.
Okay.
Nothing. Then the scientists experimented with chemicals. One chemical reduces cancer, tumor, and they found, yes, certain chemicals which are actually poison, in less dose can reduce the cancer. Also, the whole journey of the chemotherapy started in World War II.
Okay.
When by giving certain chemicals, the tumor is reducing.
Okay.
Right? And of course, now there are radiations. So radiation is like this light which is coming, but much more powerful, like a beam it comes and kills the cancer right there. So the combination of these three is something what we give for cure depending on the stage. If it is advanced stage, we cannot cure it. Then there are novel treatment, new type of treatment like immunotherapy, CAR T cell therapy,
Okay.
other type of T cell therapy, genetic therapy, like that. So time is changing, new and new therapies are coming up.
Okay, sir. Sir, what is the difference between chemotherapy and immunotherapy?
So you must have developed sore throat in life at some point of time. You take an antibiotic and that antibiotic goes into the body, kills the bacteria which has infected your body, and you get better. Same way, chemotherapy goes into the body and kills this fastly dividing cell by various methods.
Okay.
And you feel better. Why immunotherapy is like Lord Krishna.
Okay.
It does not kill the cancer directly.
Okay.
It makes your immunity fight with cancer cell, and then the immunity kills the cancer cell.
Okay.
So, like Pandava and Kaurava, Lord Krishna just made them fight
Okay.
and give them knowledge how to fight. Same way. So, immunotherapy, the usual side effects of chemo does not happen simply because it is not directly attacking anybody. It makes your immunity act on the original cell.
Sir, okay, sir. Is there any screening test or blood test for early detection of cancer?
Yes. So early detection depends on the type of cancer you are thinking. For example, now there are latest tests. You must have heard about mammogram,
Yeah.
in which we do X-ray of breast in a specific way and find out if the patient has a cancer or not. But now there are blood tests. From the blood test, we can isolate the cancer cells if it is there. We can isolate the genetic material of a cancer if it is present or not, and we can find cancer in very early stage
Okay.
when even scan is not showing any abnormality. Blood test can tell you, yes, somebody is about to develop cancer. Okay, so these are novel things. Yes, that is the limitation, that it happens over time. Same technology we use for breast cancer, then we say yes, it is effective. Then we use on lung cancer, then we use on gastric cancer. Directly, I cannot say this test will work for every cancer.
Okay.
Not like that.
Okay.
So for breast cancer, we have early detection. For colon cancer, we have early detection. Prostate, we have early detection. But for brain cancer, we don't have.
Okay.
So depends on cancer type.
Okay. So what steps should we take, like early detection, like cancer symptoms? Notice your cancer symptoms. What steps you should take?
So understand this very common misconception
Okay.
that to have cancer means I must have a symptom.
Okay.
So people think I did not have any problem.
Okay.
I don't know how this cancer increased so much.
Okay.
Stage 3, stage 4 directly. So most of the stage 1, stage 2 does not cause any symptom.
Okay.
Some little bit lump you may feel here, there, little bit feeling of not being well, little bit. You will think you have some sore throat or some problem. You will never pay attention. So most of the early stage cancer are picked up on some routine screening. Like breast is picked up with mammogram, colon cancer is picked up colonoscopy, ovarian cancer is picked up on ultrasound. So these type of screening tools which you have, you should go under once a year.
Okay.
Okay. And if you are developing the symptom, let us just say somebody is developing some ulcer in the mouth.
Okay.
Don't waste your time going here, going there, neglecting, changing your diet, taking this basma and taking this extra vitamin. If there is the ulcer not healing, increasing, make the doctor today.
Okay.
So those type of action steps you can take. We call it red flags.
Okay.
So common red flags are persistent weight loss, persistent cough. Persistent means more than 2 weeks,
Okay.
along with blood especially. Change in the motion habit.
Okay.
Somebody is having a normal motion for a whole life, and suddenly now they are constipated. They are having diarrhea someday constipation. So recent change in motion habit and sudden development of blood sugar, sudden development of jaundice. Okay, yellow, yeah, or some abdominal pain which is progressively increasing. These are the red flag signs. If it is there, no harm in getting screened for cancer.
Sir, okay, sir. What are the best foods or habits to prevent cancer?
You know what to be avoided. Anything which harms your body,
Okay.
you should avoid.
Okay.
For example,
Tobacco.
you know,
Yeah, I know.
to be avoided. Alcohol to be avoided. Smoking to be avoided, and smoking in any form to be avoided. I see young generation, teenagers, young people to in their early 20s go to hookah bar, shisha bar, and they take flavored smoke, some apple flavor, peach flavor, and then think, I'm not smoking cigarette. I am not increasing my risk of developing anything. Misconception. That smoke can still damage your body, especially the lungs. So you should avoid that. Besides this, you know that you should exercise.
Yeah.
How much exercise? That is a question. So I see young people in their early 30s or late 20s, they used to walk somewhere 15 minutes a day and then think, oh, I exercise. No, you should exercise at least 45 minutes per day,
Okay.
out of which at least 20 minutes your breath should be slightly out of. You should not be able to complete one sentence complete. So that is an adequate amount of exercise.
Okay.
Right? You should also do certain type of any type of meditation, any type of something which can calm down your mind. Stress causing diseases is a new concept or newly recognized concept from the West. Maybe in coming time we can find out, yes, stress can also damage a body to a certain extent, that little bit extra stress, little bit smoking can just tilt towards cancer.
Okay.
So you should take care of your body, you should take care of your mind and your emotions also.
Okay.
That is a complete treatment. I see a lot of people exercising but then smoking,
Yeah.
exercising but then worrying, exercising but then they're not mentally calm.
Yeah.
So a aspect of life is still damaged. So you should follow a complete lifestyle.
Okay. Okay, sir. What are some common myths, sir?
Cancer is full of myths.
Okay.
There is always one Baba who is claiming too much.
Okay.
This can be cured with something, iodine or something. There are people who will claim that stage 4 will disappear. There are people who will say that change your diet, don't eat sugar, and you will be cured of cancer.
Okay.
So myths are a majority of the videos,
Okay.
Instagram or YouTube, or majority of things you will see is actual myths.
Okay.
Many times the whole story is hidden. Patient might be doing some exercise along with some other treatment, but that fact is hidden and only this exercise is promoted. So eat this leaf, eat this bark, eat this thing, you will get better. I have seen, like, in last 15 years of my experience, 1 or 2 cases who actually got benefited with some form of alternative therapy. So there are myths all around it.
Okay.
One thing which I want to say here is, out of all the therapies,
Okay.
let us say homeopathy, Ayurvedic, all the therapies except the proper allopathic medicine, one therapy which has actually I've seen patient getting better is acupuncture.
Okay.
So pain does get better, the appetite does improve, the overall health being better does improve. But in that situation also don't expect a tumor to come down.
Okay.
So this has happened that patient is feeling better, but every time we are doing a scan, the cancer is increasing. I have seen this in real life because at our center we do give acupuncture for patient benefit. So this patient who refused chemotherapy and chemotherapy was not working, we did regular scans, we continued acupuncture. He was active till the last day of his life.
Okay.
It means he was working on the laptop, but the tumor did not come down.
Okay.
So false promises, over promises, you should be very much careful about.
Okay. Sir, how AI is used in cancer treatment?
So AI is gonna change how we treat cancer, or I should say how we discover cancer treatment. So the normal process of any medicine discovery is, first we think that this particular shape of the molecule will be helpful, and then we put it on the computer and try to do some software alignment. Then we make the process, like whatever chemical process, to make that molecule.
Okay.
Then we use it on cell culture, then we use it on animal, then we use it on human beings. Then phase 1, phase 2, phase 3 trials, like that.
Okay.
This is how we have been doing till now.
Okay.
What AI is doing, shorten this procedure. So we give command that this medicine, this type of cancer, this type of genetic material, this is the electron microscope picture of the cancer, this type of receptors are present on the cancer, and AI suggests some new type of medicine, which is yet not in the market,
Yeah.
which is yet not is produced.
Okay.
Then that design you put in another AI tool and check whether it's a stable molecule.
Okay.
So if we make that molecule, whether it will remain as a molecule or it will get destroyed because of air, because of water, it makes it. So it will just do all computational work in the computer.
Okay.
So something for which we were spending years, sometimes 10 years, can be done in 1 or 2 days.
Okay.
Then AI will also tell which chemical step to use to make this molecule.
Okay.
So once that molecule is made, then we restudy the structure of the molecule and give the data to AI. AI will tell that this molecule is going to be useful for this drug or not. So, 10 to 15 years of work can be finished in maybe a month or less using AI.
Okay.
So AI is going to change. We are going to see lot of new type of medicine available for cancer, individualized to patient. So lung cancer, this patient, there might be totally different medicine. Lung cancer of this patient might be totally different type of medicine. So this time is going to come very soon. Like in 2020, today's 25, before 2030, this is going to come.
Okay. Sir, how is cancer in kids different from adults?
Okay. Cancer in kids are different in two ways.
Okay.
First, the nature of cancer itself. For example, blood cancer is more common in children,
Okay.
less common in adults.
Okay.
And how a child respond to treatment is better.
Okay.
So, for example, somebody developed blood cancer in 50 years of age.
Okay.
There are less chances that this patient, adult patient, will get cured
Okay.
compared to a child of 2 years.
Okay.
So, first of all, disease nature is different, then the response of the treatment is also different.
Okay.
And now, children usually develop cancer of blood, kidney, liver, and the type of liver cancer of children are also different. So, same chemotherapy which work on an adult liver cancer patient will not work on a children. So, that way, there is a lot difference. Actually, there is a separate branch of pediatric oncology. So, these type of doctor sees only children up to 13 to 18 years of age. And then myself, I'm a adult cancer specialist.
Okay.
So less than 10 years or like that, if a child comes, I will prefer it to be treated by my colleague who is into pediatric oncology. I will focus on something of adults
Okay.
above 14 years of age, like that.
Okay. Sir, what is the difference between medical oncology and surgical oncology?
So cancer can be treated by 3 ways.
Okay.
Either by medicine, by injection or a tablet, doesn't matter, or by, if somebody has a tumor, let us say there is a tumor, cut it, remove. So
Okay.
this cutting and removing is done by surgical oncologist.
Okay.
The injection and tablets are given by doctors like me, a medical oncologist. And the third thing, which is laser. Well, imagine that this is a tumor and I am putting a laser on this to burn this inside
Okay.
without touching it.
Okay.
So that is done by radiation oncology. So radiation machine, look at the radiation machine, it looks similar to a CT scan machine,
Okay.
but it is many times powerful.
Okay.
So it uses the same type of radiation, but much more powerful.
Okay.
Yeah.
Okay, sir. Recently I heard. So what is CAR T-cell therapy, sir?
Okay. So CAR T-cell therapy is, in my opinion, Nobel Prize winning technology.
Okay.
What we do in this is, as I said, immunity of the person who has cancer
Okay.
for some reason is not attacking cancer.
Okay.
So we take blood of the patient,
Okay.
we take the T cells.
Okay.
T cells are the responsible immunity cells to kill cancer cell, bacteria, viruses, any bad type of cell.
Okay.
We isolate it, genetically modify to act on a particular type of cancer,
Okay.
and then give it back to the patient.
Okay.
Inside the body, they multiply, and as they multiply, since they are genetically modified, they don't usually harm other organs, but go and treat the cancer itself.
Okay.
A single drug, like once you have given a CAR T cell, it works lifelong because the same CAR T cells are dividing.
Okay.
So unlike chemotherapy, which you have to give every 3 weekly or once in a month or once in a week, whatever, again and again you have to give because it's a chemical.
Okay.
It comes out of urine.
Okay.
This T cell keep dividing it.
Okay.
So that is the beauty of the CAR T cell. And it is very, very effective, especially in blood cancer. But in solid cancer, solid means breast, lung, stomach.
Okay.
There are CAR T cell under research, which can be curable for even stage 4 cancers. So, countries like China, there are CAR T cells for breast cancer, for stomach cancer.
Okay.
We have actually sent cases there, patient who were motivated to go there and get a treatment done, and we have seen really amazing result. Really amazing result.
Okay.
Patient whose chemotherapy is not working, they don't have any treatment option, their scans were better.
Okay.
Yes, so that is CAR T.
Okay, sir. So last one question. So what is stage for cancer and how to treat this cancer stage for cancer?
Okay. The normal staging what you have or what you mean is applicable for solid cancer. Solid cancer means where in a scan you can see that there is a lump.
Okay.
I'll explain it with an example of breast cancer.
Okay.
Let us say breast cancer is only at one place, small size, then it will be stage 1.
Okay.
If it is increased in size, the
Okay.
stage 1 is becoming stage 2. So let's say 5 centimeter, 7 centimeter, stage 2.
Okay.
If the nearby lymph node, so when your sore throat is there, you develop some lymph nodes here. You
Yeah.
set
Yeah.
some. So lymph nodes are the location where bad cells get filtered. So same way the cancer also spreads to the lymph node, nearest lymph node. So the breast nearest lymph node is here. For mouth, nearest lymph node is here.
Okay.
For pancreatic cancer, nearest lymph nodes are inside.
Okay.
You cannot touch it, but it is inside.
Okay.
So where lymph node is involved, breast size increased, lymph node involved, stage 3. And when this cancer learns how to jump from this area to some other area, ear, brain, bone, somewhere else,
Okay.
then it is called a stage 4 cancer.
Okay.
At present, we can control stage 4 cancers for longer duration of time.
Okay.
We can cure some of the stage 4 cancer. As I said, CAR T cell is something which is possible that in near future we will be able to see cure of stage 4 cancer. In blood cancers, there are no stage 4, there are stage 3 only.
Okay.
Or I should say there is a high risk and low risk.
Okay.
This risk is about after treatment, whether a patient will get this disease back or not. So there is a high risk, high chances it will come back.
Okay.
And low risk, low chances of coming back. So the concept of the stage 1 to 4 is for solid cancer. For blood cancers, it is high risk and low risk only. We have stopped using stages in blood cancer.
Okay. Okay, sir. How does chemotherapy differ from targeted therapy? So what are the pros and cons?
Chemotherapy is like a chemical
Okay.
which goes inside the body
Okay.
and kill the abnormal cell, the cancer cell. As it kills abnormal cell, it also causes damage to the normal cells also.
Okay.
That is why patient can develop hair loss, mouth ulcer, because these are the cells which develop fast.
Okay.
Every day your hair is grow,
Yeah. Yeah.
but your bones are not growing.
Yeah.
So bone damage does not happen, but hair damage almost always happen.
Yeah.
Being dead, mouth, skin developing fast, dividing fast. You develop cut today, by tomorrow it is healed. So all these fastly dividing cells get damaged with chemotherapy. Now targeted therapy, there are different types, but commonly targeted therapy are the chemicals which somehow find out a cancer cell in the body through blood and get attached only to those cancer cells
Okay.
and attacks or damages all the cancer cells.
Okay.
It does not cause other side effects.
Okay.
Usually, theoretically. Practically, we see that targeted therapy, whether it is gene targeting
Okay.
or on the tumor, there are some protein targeting or anything, any other way that targeting a cancer cell has some side effect, but much lower. Usual side effects of hair loss, how the ulcer does not happen. You will develop other type of side effects like gastric upset, as if you have eaten something bad. So somebody may develop loose motion type of thing. Somebody may develop uh, heat in the body.
Okay.
So the hand, mouth, feet, they may feel hot.
Okay.
These type of side effects are there. They are different than chemotherapy, much more easily manageable compared to chemotherapy.
Okay, sir. Okay, sir. What is blood cancer and what are the types of blood cancer?
So blood cancer, to understand what is blood cancer, you have to understand where the blood is produced.
Okay.
So blood is produced in the bone. This bone,
Okay.
like you must have seen in the center part of bone, there are yellow kind of bone. So that is known as marrow,
Okay.
bone marrow.
Yeah.
Normal blood is produced from there and then it comes in the veins.
Okay.
Now in this marrow, if whatever reason abnormal cells start developing,
Okay.
then it is known as blood cancer.
Okay.
Now there are two types. One is fast growing blood cancer,
Okay.
known as acute blood cancer.
Okay.
Fast, they grow. They within a month or 2 months, either they are cured or they just kill the patient.
Okay.
And then there are slow growing blood cancers. We also call it chronic blood cancer.
Okay.
Right? In this fast growing and slow growing, we have further divisions like acute lymphoid, acute myeloid. There are multiple subdivisions.
Okay.
Same way in this chronic slow growing type of blood cancer, there are multiple ways,
Okay.
multiple divisions. For this type of fast growing, we have to give chemotherapy.
Okay.
For this type of slow growing, they are often controlled by just certain tablets. Example, I will give you imatinib.
Okay.
It's a tablet came in 2002, and with chronic blood cancer type of people are still taking this imatinib for last 20 years and they are okay.
Okay.
So slow growing, slower treatment.
Okay.
Fast growing, fast treatment.
Okay.
Like that.
Okay. So మనము నాకు భరత్ పటోరియా ఈజ్ ఏ ఫేమస్ అంకరాయిస్ట్. సో మనకు ఈరోజు క్యాన్సర్ గురించి మనకు అందరి మైండ్లో జనాల్లో మెదిలే డేట్స్ గురించి క్లారిఫై చేశాడు. సో ఏంటంటే నెక్స్ట్ పాడ్కాస్ట్లో మనం ఇంకా ఎక్స్ట్రీమ్లీ డెప్త్గా తెలుసుకుందాం. సో థ్యాంక్ యూ.